Okay. What is breast cancer? Breast cancer is a type of cancer that organizes in the cell of the breast. It can occur in both men and women, but it is far more common in women. Breast cancer usually begins in the milk ducts and glands and has a potential to invade surrounding tissues. Yearly detection through screening and awareness plays a crucial role in successfully treatments outcomes. Treatments may involve surgery, chemotherapy, radiation therapy, or a combination of these, depending on stage and type of breast cancer.
Hello, my name is Elisha Minturusli. Today I'm going to talk about symptom of breast cancer. The first symptom that you can have from a breast cancer is a lump or a thickening in your breast area. The second one is a change in the size of your breast, like your right breast and left breast not asymmetry. Like the right side is bigger than the left side. The third symptom of breast cancer is a nipple change or invasion, and also you experience discharge or bleeding from your nipple. The other common symptom of breast cancer is skin change of your breast, unexplained swelling at your breast, and also non-healing wounds or ulcer in your breast area, and swollen lymph node, like we describe it as a lump at your armpit area. And also I want to talk about breast cancer isn't always about lumps. Like I talked earlier about the common symptom, it can be a rash in your breast area, and the rash is inflammatory. It is one of a type uncommon symptom of breast cancer that doesn't cause a lumps. Puckering or dumping of the skin usually cause of a deeper breast lump that pulling skin inverts. And also skin around the breast resemble an orange peel known as a peel d'orange that can cause cancer cells that blocking lymph vessels in the skin area, and that becomes a orange skin of in your breast area.
Mammogram is a picture of your breast taken with a safe, low-dose X-ray machine. Your technologist will ask you to stand facing the mammography machine and then place one breast at a time on a flat surface. Another flat surface, called a compression paddle, will gently be lowered into place to compress your breast. Compression is necessary to spread out the breast tissue and to eliminate motion, which may blur the image. The compression may be uncomfortable but shouldn't hurt. Compression usually lasts no more than 20 to 30 seconds. During this time, an X-ray beam comes from above and penetrates your breast tissue. The X-ray image is either created on a film cassette, located below your breast, or recorded digitally and stored in a computer. Denser breast tissue, such as cancer or calcifications, appears bright and white, whereas less dense tissue, such as fat.
Okay, hi, my name is Sarifah Khadijah Binti Rahmain, and I would like to share about types of breast cancer. Okay, whether your cancer is not invasive or invasive will determine your treatment choices and how you might respond to the treatments you receive. So there are two main types of breast cancer. Okay, first is non-invasive cancer and have two categories. Okay, so first categories is that the carcinoma in situ, DCIS, and second categories is lobular carcinoma in situ, LCIS. Okay. Okay, second type is invasive cancer, and I have also two categories. Okay, so first category is invasive ductal carcinoma (IDC), and second category is invasive lobular carcinoma (ILC). Okay, did you guys know what is non-invasive cancer? Okay, non-invasive cancer, or we call it carcinoma in situ, is when abnormal cells grow inside the lobules or milk ducts but have not spread to the surrounding tissue or beyond. So the condition is called carcinoma in situ. What is invasive cancer? Invasive cancer is not the same as metastasis. Okay, so metastasis occurs when the cancer cells break away from the primary tumor and spread into organs in other parts of the body, okay, through the bloodstream or the lymphatic system. So most invasive cancers are either ductal or lobular in nature. There are so many types of breast cancer that you need to know as a knowledge. So you can see, okay, the attached picture in this video.
Hi everyone, my name is Ida Nufarisha. Today I'm going to share about stage of the breast cancer. For everyone's knowledge, breast cancer has 4 stages. Healthcare providers use cancer staging system to plan treatment. Staging cancer also have provided set a prognosis or what you can expect after treatment. Breast cancer staging depends on the factors like your breast cancer type, tumor size and location, and whether the cancer has spread to other areas of your body. Breast cancer are from stage 0 to stage 4. From stage 0, the disease is non-invasive, meaning it hasn't spread from your breast duct to other part of your breast. It means that it has not spread beyond its original site or location within the body. In the context of the breast cancer, when it states at the disease in a non-invasive, it implies that the cancer cells are confined to the breast duct and have not spread into surrounding tissues or other part of the bodies. This is a positive indicator in the term of prognosis and treatment options, as non-invasive cancer are typically more easily treatable and associated with a better outcome compared to invasive cancer. Next, when it comes to stage 1, there are cancerous cells in nervous breast tissue. It means when there are cancerous cells found in nervous breast tissue, it indicates that the cancer has invaded beyond its original location and has spread to surrounding tissue within the breast. This is referred to as invasive breast cancer. Invasive breast cancer is more serious than non-invasive or in situ breast cancer because it has the potential to spread further to other parts of the body, such as a lymph nodes or distant organ through the bloodstream or lymphatic system. The presence of the cancer cell in nervous breast tissue typically necessitates more aggressive treatment strategies such as surgery, chemotherapy, radiotherapy, or target therapy, depending on the various factors, including the extent or spread, the type of the cancer, and the individual overall health. Stage 2, the cancerous cells have formed a tumor or tumors. The tumor is either smaller than 2 cm across and has spread to underarm lymph nodes, or larger than 5 cm across but hasn't spread to underarm lymph nodes. Tumors at this stage can measure anywhere between 2 and 5 cm across and may or may not affect the nervous lymph node. Stage 3. Their breast cancer is nervous tissue and lymph nodes. Stage 3 is usually referred to as locally advanced breast cancer. Locally advanced breast cancer to cancer that has spread beyond its original site in the breast to nervous tissues or lymph nodes, but has not yet metastasize to distant organs such as lung, liver, or bones. This stage of breast cancer is characterized by the presence of cancerous cells in the breast tissue, lymph node in the armpit, or in nervous structures such as the chest wall or skin. Locally, advanced breast cancer is typically considered a more advanced stage than early-stage breast cancer and may require more aggressive treatment approach, including a combination of surgery, chemotherapy, radiation therapy, hormone therapy, or targeted therapy. The goal of the treatment for locally advanced breast cancer is to shrink the tumors, eradicate any remaining cancer cells, and prevent further spread or recurrence of the disease. Lastly, stage 4. Cancer has spread from your breast to areas like bones, liver, lung, or brains. When cancer has from its original site in the breast to other areas of the body such as the bones, liver, lung, or brain, it is referred to as metastatic breast cancer, also known as a stage 4 breast cancer. This stage indicates that the cancer has advanced beyond the breast and nearby lymph node to distant organ or tissue through the bloodstream or lymphatic system. Metastatic breast cancer is considered the most advanced stage of breast cancer and typically associated with a more challenging prognosis. The spread of the cancer to vital organs like the bones, liver, lung, or brain can lead a variety of symptoms and complications depending on the specific location of metastasis. Treatment of metastatic breast cancer aims to control the spread of the disease, alleviate symptoms, prolong survival, and maintain the patient quality of life. It often involves a combination of systematic therapy such as chemotherapy, hormone therapy, targeted therapy, immunotherapy, radiation therapy, and supportive care. The goal of the treatment in this stage is to manage the disease as a chronic condition, as complete cure may be difficult to achieve.
Greeting everyone. Today I want to talk about risk factor and prevention about breast cancer. The risk of factor of breast cancer number one is about age. The risk of breast cancer is increased with age. Other women are more likely to develop breast cancer. Secondly, family history. It means there is a family history of breast cancer, especially if it occurred in the mother, sister, or daughter. The risk may be higher lah. And number three is genetic factor. It mean mutation in the BRCA1 and BRCA2. It mean to people in that genes can increase the risk of breast cancer, and genetic testing can help identify individual with a higher genetic risk. And number four, factor of breast cancer is previous cancer history. Women who have had breast cancer before have a higher risk of developing cancer in the other breast cancer or on the same site. And number five is sex hormones, elevated estrogen level, such as early menstruation, late menopause, or hormone therapy use can increase the risk. And lastly, the factor of breast cancer is smoking. Uh, Lastly is lively. The activity can make breast cancer is smoking, alcohol, lack of physical activity, and unhealthy diet can influence the risk of breast cancer. How to prevention the breast cancer? Firstly, we must early detection. It mean make a examination at any clinic or hospital. Second, lively change, adopting a healthy lifestyle, including a balanced diet, regular exercise, no smoking, don't drink alcohol, and reduce the risk of breast cancer. Third, we can preventive therapy to women lah at a high risk because women have a high risk to breast cancer. Uh, Preventive therapy such as the use of estrogen medication or surrogate intervention may be considered after consulting with a doctor for genetic testing. More to women with a family history or high genetic risk may consider genetic testing to mutation that can affect their breast cancer risk. And five, education and awareness, increasing public awareness of risk factor, sign and symptom of breast cancer, and the importance is prevention and early detection through educational campaign. And lastly, how to prevention the risk of cancer is Moto women with complex family history or high genetic risk may consider genetic counseling to discuss appropriate prevention option for their situation. And that's all from me. Thank you.